Hi, I'm Debbie Carroll. I'm with the Senior Sage, and I'm also a family caregiver. I
Hi, everyone. My
decided.
name is Caitlin Connolly, and I'm the project director for the Elder Care Workforce Alliance. The Elder Care Workforce
Thanks a
Alliance.
lot. My name's Drew Holzoffel, and I'm with REACT, which stands for Respect to Caregivers Time. We're
Good
about
afternoon, everybody. Thank you for having me here, and thank you, Grace and colleagues, for allowing me to come in. I came over.
Um, I think as a family caregiver, you see changes often before a physician would. Absolutely before a physician would. And we're also the advocate for our loved ones, and we, in a lot of cases, need to be able to speak for them. In my situation, my mom has Alzheimer's disease, and she doesn't remember. So if a physician would ask her, I'm going to increase this dosage of a medication, she wouldn't remember to do it. So it would all kind of fall onto me. I'm the one that would know.
We also know we do a lot of work in Alzheimer's, and this is, again, getting back to Debbie's point. With Alzheimer's, 80% of the diagnosis are driven by a caregiver. So 10% by the physician, 10% by the patient themselves. So the importance there is that the caregiver is in the clinic and advocating for change. So I always used to say that if you want something done, that you should go see a nurse. Now I change that to if you want something done, you should go see a caregiver. And I really see the caregiver as the chief medical officer.
Perspective, this interdisciplinary care team recognizes the valuable and invaluable role that family caregivers provide. So we also know that they are going to be in more of a demand as time continues. So by 2030, 1 in 5 Americans is going to be over the age of 65. Right now, or in 2009, family caregivers provided $450 billion of unpaid care, valued as unpaid care. And so we know that the critical role these family caregivers provide is only going to become more urgent and necessary. For example, this interdisciplinary care team, I think that the two things to take away from it are, number one, it is going to require everyone who can help to provide that care, who can help for an older adult to remain as independent and as healthy for as long as possible. The other part is that it should both be person and family centered, and that means that the care is looking at the individual and at the family, not just their health needs, but their entire needs. So it really takes a whole person approach to try to figure out how do we support people. It's a very simple concept when you think about it. It's how do we provide the best quality of care? How do we have the best quality of living as possible?
Drive for change. Now to switch a little bit from an employer perspective. So if you think about the caregiver who's also an employee, the importance of including them in a healthcare team really centers around the fact that the employee might have access to resources that the person who needs care doesn't. And this ties in with your EAPs. So a lot of employers offer access to geriatric care management services, legal and financial planning, for example. So it's not just looking at how you take care of the patient when they're with the physician, but it's how you support the loved one through all the resources that are available. And so the more people you have engaged in the care of the patient, the better off the patient is, and the better the outcome.
And for those who are working and trying to juggle the work responsibilities in your family life, it can be really, really difficult and very challenging. And I know that I walked a fine line between keeping my personal life personal and then also being able to fulfill and try and be professional, fulfill my work responsibilities.
The next several years, you'll have over 80 million baby boomers that are eligible for benefits of Social Security. So it's even more important time to start thinking about, even as a caregiver, having to take time off of work, whether or not a person has their quarters of coverage. They want to see the record. They may have not received their Social Security statement since that's been on and off, suspended, not suspended, and which is one of the big drivers of why we're encouraging caregivers, whether they're working or not working, to sign up for a My Social Security account, which I'll kind of elaborate a little more in the discussion further on. But that could be one solution to assist to kind of plan for that 10, 15, 20-year perspective. And we're even targeting folks in the what's called the sandwich generation, which may not be the folks that are 50s and 60s, but actually in their late 30s.
I would flip it, and I would say the employer needs to make the case for why the employee should be staying with that employer. And I think that if putting the onus on the employer, putting the onus on the frontline manager, we've seen employers respond in fantastic ways. Think about childcare. Think about how embraced that is in the workplace. And so why wouldn't we expect the same thing from employers in terms of elder care? So the bottom line here, I think, is that awareness isn't the issue; it's the action. And so if an employee feels they need to make the case, then I think they just need to have that conversation. I think that there's a lot of resources out there that employers are offering that aren't utilized. So it's really about just taking the first step. It's easier said than done, I'll give you that. But I think that the time is now to do that.
Just like childcare, I had to juggle and fix childcare because I'm in that sandwich generation. There was lots of options for childcare, but there weren't so many options for an adult as to what you do when the adult's wandering or the adult is, needing more care and needing to make more frequent doctor's appointments. And I pretty much exhausted all of my sick time, all of my vacation time. I tried taking a leave of absence. So I definitely agree with what Drew's saying as well, that trying to be willing to juggle and try different things. But at the end of the day, for me, I did have to stop for almost a couple years to try and get things straightened out, and then I was able to go back.
And it's not just large companies, and this isn't just an issue that HR can solve. So it's not just big company benefits. It literally costs zero to have a conversation, right? It costs almost nothing to have a cultural shift to where this is embraced. So I think that while there are maybe advantages in terms of what a big company can offer from an HR department or access to resources, this is something that every employer can do. One of our best members is the U.S. Chamber of Commerce, and they're the voice of small businesses across the country. And so they clearly see that there's something that their members can do. So I think it's as simple as having the discussion, and I think there should be a push-pull here. And so the employee should be pushing, and the employer should be pulling. And if we take that approach and start having the conversations, everybody's going to see how normal this situation is. When you keep it isolated, you feel unique, and then it makes it hard to have a discussion. If we start talking about, we're going to realize that we're all in this together and we're all experiencing the same thing. What are the best practices? Some of the most interesting practices are starting to center around the use of technology. And this can be as simple as just using the company intranet to distribute documents. But there's some also really, really interesting things. There's an example of one of our member companies who actually has a service where the employee from their desktop can remote in to a physician visit. So essentially, they don't have to leave the workplace. And if you were sitting in New York today, and if you know how long it would take to drive somewhere in New York City, that's a lot of time away from work. So they're able to still be in the exam room. Making Debbie's point earlier is, you really want that person as part of the care team. So if you're in that exam room, but also you cut down on the commute time, That's just one example of a best practice. Some of the other types of best practices, we talked about geriatric case management. And in our research with Gallup, we learned that the number one thing that employees want is just access to legal and financial planning. And they're actually not asking for that benefit to be paid for. They're just saying, tell me who I should go to. Give me some type of validation that this is a short list of the best people in the area. It's really just cutting through the clutter. So I think best practices, just to underscore an earlier point, you don't have to be a large company to have a best practice. You just really have to kind of set your mind to figuring out what your employees need and finding a way to deliver it.
One of the important things that Social Security offers for individuals who are filing for disability, or let's say caregivers assisting their family member or someone that they're close to, that they're helping, being taken care of. If an individual is found to not be capable of handling their benefits, many people are not aware of that Social Security itself, when it comes to managing funds and services with our agency, we don't recognize power of attorney. So we have what's called the representative payee program, where a caregiver could possibly be a representative payee of their family member, manage their funds and their accounting, and also be the liaison when it comes to medical redeterminations. And that's when we kind of check in from time to time as an agency with individuals to see if their disability continues to be, or if there's been improvement, and what other services can we offer the individual, and also to assist the caregiver. So that, when you're creating the My Social Security account and you have all the responsibilities going on, one sometimes doesn't realize the earnings record may not be correct. And not having a correct earnings record could make a $20, $30 difference a month in a person's monthly benefit when it does come time, 10, 15, 20 years later down the line, if they decide to do it at 62, or most of our baby boomers right now filing are around the 66 range, up to 67, and then even gives you a perspective, depending on the longevity in your family and your financial situation, to do the delayed retirement credits to 70. So the My Social Security account, what it gives you is a nice groundwork for using our other tool, which is the Social Security Estimator, where you can actually do what-if scenarios. What if I retire here with this amount of monthly of benefits, or I decide to work part-time but receive benefits? What are my earnings limit? And that kind of takes you down the path. And for a caregiver, that could be really important, because they may say, well, maybe I don't have to leave my job completely. I can work part-time, collect Social Security at the younger age of 62. What's that going to do? Even though it's a permanent reduction over the years. However, depending on the earnings amount that they have, let's say they're over the earnings amount, it doesn't mean we stop all the checks. We may have to hold several checks. And let's say between the ages of 62 and the full retirement age, we hold 12 checks. When that person, the year after the full retirement age, we no longer count their earnings against them for the purpose of paying their monthly benefit. We actually put that back into the mix and recalculate their benefit. And they'll be able to see that with the My Social Security account. In addition,
so I know from my personal experience and my family's personal experience, being a family caregiver, I think, was one of the most challenging things you can do. And not only is it difficult to maintain what is going on in your life, but then to be juggling and trying to figure out what is the best care and what is the best course of action for your loved one, that is exhausting and requires the right resources. It is also extremely rewarding. I know that from my family's point of view, for my grandparents, being able to live their days by being able to choose their setting, that they wanted, to be able to choose the care they wanted, or to be able to identify how they wanted to spend the rest of their days. It was really,
making sure that you let people also help you, because it's a great journey. It's also a really scary journey. It's also a very hard journey. So being very specific also in asking people for help. So, I mean, it's also a challenge, but it's also, like I said, a blessing.